So what do you do in an emergency? So in the cases where, like I said, 4 years ago when I came across these emergencies, I actually didn't really expect that that would ever happen to me, none of them. But they did happen, and they don't always happen to just a nurse, or they could just happen to you. And especially in time of disaster, when someone's, fallen out or they lost their blood sugar goes low. But you want to make sure that you evaluate the scene always. No matter what happens, evaluate what's around them and evaluate if there's any damage that could possibly come if you enter the scene. And always, number 2, remain calm, because as soon as you get really hyper or you start screaming really loud or you don't know what you're doing, in your mind just goes off if you see something that you've never seen before. Just remember, remain calm, and number 3, don't move the person unless an immediate danger like a fire or flooding, of course, unless they're going to die. Unless you have to move them if they're going to die, either, but don't move them if they, passed out and they're just laying there. And if they got hit, you don't know if they broke their neck or whatnot. So number 4, call for help. So you get there and you're calling for help, whether it's loud or you have your cell phone with you and you can do something at the same time. Number 5, ask, is the person choking? I mean, honestly, and 6, they kind of go together, but when you look at the person, are they breathing? Airway, breathing, and circulation. You have to make sure you're looking at all those 3 things, because those are going to be crucial, whether they'll live or die. And number 7, if they're not breathing, of course, and you realize that you perform CPR if their heart is stopped. Number 8 is person bleeding. I mean, you want to look at that. Make sure you look underneath their back or like what they're laying on. If they're bleeding and you can't see it at that point, but make sure you kind of look. Just kind of look to see if there's blood or anything anywhere, any liquids. Number 9, shock. Ask the question, if they're going through shock, and I'll tell you what shock is in the next slide. Number 10, do they need I guess the slide after that. The recovery position. So if they are choking on something, or you notice there's fluid, and you want to roll them into the recovery position because you don't want them choking on the fluid. And the recovery position is actually to their side with their knee over the other leg and their arm over like that. Does that make sense? Okay. And get CPR certified. So I'm not actually going to teach you CPR tonight. That would take another whole class. And I just recommend everyone here get CPR certified. And you can get that through any American Red Cross or through hospitals. You can also go further and get an EMT course at hospitals, universities, or colleges. They're all great ways, and they're all very important. It's really important to have CPR.